I want to get back to the pandemic now, though, and catch up with Professor Peter Collignon again. Peter, thanks for joining us. Can you give us the latest 11 cases now, 11 infections in this outbreak in Sydney's cluster, I should say, in Sydney's eastern suburbs? A light touch still from Gladys Berejiklian, mask wearing mandatory in some situations. Do you think it looks like this has been contained and it's going, the plan of containment is going well?
Well, so far, because the more recent cases have already been in isolation, but we just have to see how it unfolds. But if you look at all the outbreaks we've had in Sydney and in Melbourne and around Australia, they've all been contained within 2 to 3 weeks. Melbourne's gone a bit longer because, in fact, it was 2 clusters that overlapped each other, the Kappa 1 and the Delta 1. And as much as everybody's quite worried, realistically about the Delta variant being more transmissible, so far in Australia, it's behaved the same as the previous strains we've had, looking at how many people in the family get infected, as well as those who are close contact. So it's not falling out of the standard thing we've done so far. And to date, it's worked quite well with all the clusters we've had in Australia. And I would expect this will be the same. But we just have to wait and see. And it's really important we get that testing. People cooperate when they're supposed to isolate, quarantine, etc. Because it's better just having, many hundreds or 1,000 people locked down rather than a whole city of 5 million.
Now, you've been very clear and very cautious but very practical throughout this pandemic. And once again, this would seem to demonstrate what we've seen so far is the sort of thing you've argued all along, that most of these lockdowns have been unnecessary, that the containment, the contact tracing has worked. And it looks now, let's cross our fingers, don't get ahead of ourselves, but it looks like that approach has worked, is working in Sydney now without imposing that horrible burden of a lockdown on the whole of a metropolitan area. Even though some states, of course, are throwing up borders and all the rest of it, New South Wales seems to be doing this very, very effectively without an unnecessary burden on so many other people.
Well, I think New South Wales is the only state still following what was the original game plan, which was to suppress to really low levels, contain this. The reality is New South Wales, by having that strategy, has eliminated every time there's a virus or a new virus that's came, and it has eliminated over a period of 2 to 3 weeks. And I can't see that their results are really any different to the other states that have gone much harder, or New Zealand for that matter. So far, this strategy has worked, but it has minimised the social and other costs, economic costs to the society as a whole. Now, as we get more and more people vaccinated, we're in a better position because, first of all, you'll have less spread. And secondly, the consequences of that spread will be much less marked because particularly if those over the age of 70 are vaccinated to a high degree, it means your death rate will be 90% less than if you didn't have those people vaccinated.
Absolutely. It gets better all the time. Just on that then, what about a case we've highlighted of a couple who have come back from the United States? They've been in quarantine for 5 days. They've tested negative 3 times. They're both fully vaccinated. What is the risk of them being flown to Brisbane to visit a dying man, obviously with the potential for all sorts of isolation and mask wearing, any special considerations or restrictions put on them that anybody should so desire? Surely that's a relatively safe option.
Well, I think if you're taking extra precautions as well, you might remember Brisbane actually allowed, a couple who came back from Lebanon that were infected to go to the hospital because they needed to. So, look, there should be some exemptions where you can make the risk very, very low. You can never make it zero. But if you're vaccinated, you've got negative tests and you're wearing a mask, etc., and people around you are wearing masks and face shields, well, the risk must be really, really minimal. And I think we've got to have a little bit of give and take about some of these situations that are fairly desperate for people, where we can do it, I think, with an acceptable, really, really low risk.
Absolutely. Let's hope common sense prevails there. Now, if we were to give you 30 seconds in front of the National Cabinet, Peter, would you say to the other state premiers that they should follow what New South Wales has done, use that as their template and use it fast?
Well, I think I would, actually. I think New South Wales has contained this, has eliminated, in fact, every time a virus has appeared. It takes a couple of weeks, a few weeks, but I don't think their results are any worse than the other states that have gone harder on New Zealand. So I think that is the way to do it if you want to minimise the social and economic costs. Now, we'll have to wait and see. But again, the more and more we get vaccinated, particularly those over the age of 70 and 60, with the vaccine we've got available in large quantity, which is AstraZeneca, all will be better off, and all the things that happened last year in Melbourne won't happen. Instead of 800 deaths, you might have 40 deaths. Now, we'd like to avoid all of those, but there is a reality eventually we're going to have to come to terms with. If this disease will become endemic, it'll spread slowly, it'll be worse in winter, but providing we get lots of people vaccinated, the consequences will be no worse than what we see with influenza every year.
Peter, thanks so much for joining us again.
Thank you.
Professor Peter Collignon there.